My name is Dr. Mike Blanchard, and I've been active in clinical practice in the field of chiropractic sports medicine for the past 20 years. I'm also a former commissioner of the California State Board of Chiropractic Examiners and a former world-class amateur and professional athlete. That combined experience of being a high-level athlete and now being in clinical practice for 20 years, seeing patients day in and day out, has given me a unique insight into the treatment and analysis of patients. And it's the depth of that experience that's allowed me to develop and adapt a process of patient examination and treatment that has allowed me to get results that I just was not able to get before. And I like to call this process functional healthcare. Functional healthcare is really about the body's ability to move. And when we have an injury, an ache, a pain, experience a physical trauma of some sort, it causes us the inability to move fully, whether it's a single body part or it's a combination of things that cause us to move more slowly, to move less efficiently, to be moving about in pain. So with functional healthcare and a detailed hands-on functional analysis, which is really the crux of this process, is the hands-on functional analysis of the tissues of the body, the muscles, the tendons, the ligaments, the joints' ability to move through ranges of motion with strength and power and quickness. It's that analysis and the treatment that we develop because of it that allows us to get the results that we just haven't been able to get before. Patients will often refer or comment after they go through this process, after the exam process, and say that they've never been through an exam like that before. There was so much involved and it was so detailed. And the information that we gain from it and how we communicate it to the patient is very logical. The best part about it is that the patient gets it. They understand why we're doing what we're doing and they participate in it with me, which is a phenomenal experience for me and for them because the results are much better. So what are the results? Well, the results are that we get a very rapid return to function and typically a very rapid reduction in pain. Now, an example would be a patient will come in with a shoulder condition. They may not be able to lift their shoulder above, lift their arm above their shoulder. But after we go through the process, sometimes in a single 20-minute session of treatment, the patient has complete range of motion, even after having tried many different things to restore that range of motion, more traditional forms of treatment, and we're able to get it back within 20 minutes. And that's a great experience as well, again, for me and the patient. So I encourage you to dive in to learn a little bit more about the functional analysis and functional healthcare. I look forward to participating and the privilege to participating in improving your health.